Hi friends, good morning and namaste. So I'm going to be talking today about non-surgical nose job or non-surgical rhinoplasty. So my staff have given me a series of about 10 or 11 questions that a lot of our subscribers are asking us pretty regularly on and off basis, and I haven't really addressed them since a long time, or if I've ever addressed, I don't remember really. So I'm going to talk maybe a few minutes about the various aspects of non-surgical rhinoplasty. Now, what is non-surgical rhinoplasty? Non-surgical, as the word says, there's no surgery being done. So some people also call it as a liquid rhinoplasty. So what is basically done in this is fillers or injectables are taken and injected onto the nose to augment the nose or to make the nose slightly bigger. So you have to understand that you cannot reduce the over-projected nose with a non-surgical rhinoplasty, because that's also one of the questions that a lot of our subscribers or patients do ask. Now, let's imagine the patient has an issue with a bulbous tip. Is that fixable with non-surgical rhinoplasty? Most of the cases, it's a big no. So non-surgical rhinoplasty is a type of a procedure which is day care, meaning patient comes in, sits in the OPD, and we do the procedure, which is taking about 10 to 15 minutes and all. Injectables are done, it's not painful, it's safe, the results are predictable, but yet it has a big side effect or a big issue. I wouldn't call it a side effect, big problem. That is, it's not permanent. So all these fillers that we use, we have different types of fillers. I'm not going to get into that today, but the various fillers that are being used for this kind of non-surgical rhinoplasty, they have a shelf period of about 9 months to a year in the nose. After that, the body absorbs them, and so the effect goes off. In some patients, it tends to linger around longer, and in some areas of the nose, it tends to stay longer than the other areas. So that's a bit about non-surgical rhinoplasty. Now, another question is, how many days does it take? So I said earlier, it's a day care procedure. So you come in, get it in and go back. But really, for the results to look nice and natural, I think it takes about a week to 10 days at most. The procedure is done by injecting the fillers, and so there'll be some redness initially, and after that the redness goes off and you'll have a nice contour. Now, what about ethnic noses? Absolutely. So if you have a nose that's very broad, so you can augment it a little bit by using this technique. Yes, you cannot get that super sharp, super defined tip that we can get with our surgical rhinoplasty. So this is a very nice adjunct or an add-on procedure that helps patients that are having the particular goals for this. Now, one of the reasons or one of the type of patients we do this is for patients who want to try and see how it looks, or for people who do not have a lot of time. You know, a surgical rhinoplasty needs like a week stay here. A lot of them, we need to harvest the rib, or we need to do osteotomy, various grafts, and in this, none of those things. So if you do not have much time, and if you are looking to get that better nose for an engagement or a wedding or for a family function, for anything, this is a good option. So, but please send us your details, WhatsApp us your pictures, and we'll let you know if you're a good candidate in the first place. And if you are a good candidate, and if you think you are a good patient for benefiting from this procedure, then we can give you all the details in the WhatsApp consultation itself. Now, the last question, or one of the main questions, is what does it cost? The good news is it's not that expensive. So in Indian rupees, I think it starts about 25,000 rupees onwards here if you come down to a Nagarcoil center, which is in the south of India, and it can go up to maybe about $1,000 at most. But all of this depending on the amount of fillers, for the type of patients, what type of fillers we use, and so on and so forth. But that's the range. So still very affordable, and it's still very doable because it doesn't take much time. So that's a good option you have if you're looking to augment the facial aesthetics, especially on the nose with a liquid rhinoplasty. One more question, people are asking if it can go wrong. Now, any procedure can go wrong. So even liquid rhinoplasty, if it's done by an expert, I don't think it can go wrong. But if it's not done by an expert, it can go wrong. How can it go wrong? It can go wrong if you inject the filler in excess. So then what happens? It leaves another bump or it leaves another issue or a deformity that can be there for a few months. So that's one of the things can happen. The second thing is you can have bleeding. Third thing is if you don't inject in the right space and if you don't inject in the right quantities, it can also lead to infection. Now, I'm not a surgeon who does a lot of fillers personally, but we have a team here. We have another oculoplastic surgeon, another facial plastic surgeon, and they also do these kind of non-surgical rhinoplasties or liquid rhinoplasties. Basically, they're good with fillers. So while I specialize and I do more of the surgical work, our team here, other members, Priya and others, they would be doing these kind of non-surgical procedure, which is I think going to be very useful. So if you have any more questions that I've not already answered, or you want to directly get a consultation on our WhatsApp, which is absolutely free, you may feel free to do that. If you have any more questions, you can also message us on our message section in the video below in YouTube, and then we'll be more than happy to address each and every one of them. I hope this video was useful. If you are interested in knowing more about certain different facial plastic procedures, and you can ask our questions so we can try and collect these questions like what we did now and come up with these videos from time to time. Thank you.